You're healthy until you're not. A lot of us, even if we're older and know better or should know better, we don't really understand exactly how important our primary care physician is to our health. And that's what this video is about, your primary care physician. This is the second video in our series for seniors, What to Do Before You Get Sick. After years of experience as patients in our vast medical system, Art and I have found out that the second most important thing you can do before you get sick is to make sure you have a good primary care physician, your PCP. I call them the gatekeeper.
We're going to tell you why we found them to be so important, and we're going to give you some suggestions to help you choose a good one if you don't already have one. Remember when your general practitioner or GP was the doctor that you went to see to in a fairly regular basis? Well, in today's world of medicine, where everybody is a specialist, they are now called primary care physician.
It's actually a pretty good title. Let's face it, we all know what your primary care physician does. They diagnose illnesses, order testing, prescribe drugs and treatments, and refer you to specialists as needed. But a lot of folks, particularly as we get older, mistakenly figure, well, if I'm not sick, I don't need to see my PCP. Of course, they're forgetting that one of the most important services your primary care physician provides is preventative care to help you stay healthy.
Let me tell you a story of exactly how important a primary care physician can be. I see mine twice a year, once for an annual checkup, and the other for about 6 months along the way in between the annual checkups, just to see if there's anything has changed in between. On a recent visit, my PCP noticed a little funny change in my walking. He referred me to a specialist, who then referred me to physical therapy, and within about 2 weeks, the condition was cured. Without my PCP, I probably waited until it was going to be a lot worse and a lot more difficult to take care of. Of course, as we get older, we have more aches and pains, and the value of our PCP can increase quite a bit.
Now, equally as important from our point of view, your PCP is keeping track of your health history, which allows them to, and of course, share with any doctors they need to. It allows them to become experts in your personal health. Now, that may not sound like much when you're well, but if you get really sick, go into the hospital or even urgent care, that information can be critical. It can help ensure that you get the best care for you.
We all know that in today's medical system, it's common for your primary care physician to refer you to other specialists. But if you go to an urgent care, the emergency room of a hospital, or even a skilled nursing facility, the doctors there will take charge of your day to day needs and prescribe medicines and probably change things that even your primary care physician has done because your environment has changed quite a bit. What's then the point of having a primary care physician? Well, that's the person who supervises your health issues over the long term. So when you are discharged from your hospital rehab, that's the person who's going to make sure that you're continuing on a healthy path. He is your personalized health manager and coordinates with all of your specialists over the long term.
You may remember that old story of multiple people who are tasked with trying to describe an elephant while they're blindfolded. They were only allowed to touch a specific part of the elephant. So, of course, the people who only touched the trunk described a very different beast than those who had felt only one of those massive elephant legs, or one of the persons who had only experienced that skinny tail. You'll have to excuse my analogy, but in a way, your primary care physician sees the whole elephant. Your PCP sees everything in your medical file over time, including everything the specialists recommend. That's extremely valuable for your continued health.
Don't have a PCP or one you don't have confidence in? Get one now. Here are some tips on how to choose a primary care physician who's right for you. First, make sure they use a popular online patient portal so they can share your medical information with hospitals and other doctors you might use. A good example of a popular one is MyChart. Next, ask if they have admitting privileges to your preferred hospitals.
Besides being a primary care physician, ask if they happen to have a specialist, a second specialty, in an area of importance to you, such as diabetes, geriatrics, neurology, cardiology, whatever your health issue might be. Now, most primary care physicians specialize in only that, in primary care. But there are a number of PCPs who also have a second specialty. And if you can find one whose added specialty addresses whatever your particular needs are, I think you get an added bonus. One other thing, and that this is also important, be sure to ask if they accept Medicare and be sure that they will accept your particular insurance as well.
John, is that a good point? I've noticed when I go to some of my specialists, they have a little sign on their window saying what insurance companies they don't accept. And that's relatively new. So I guess their reimbursement schedules are different, or maybe they can't even work with them. In any event, if you get stuck with one of those kinds of insurance companies with this particular specialist, you're going to have a really rude awakening when you get to pay a copay that you weren't expecting.
Good point. Ask first. Okay, before we go, we have some important recommendations for you.
First, you must be proactive with your primary care physician that you see regularly. Next, build a relationship. They need to know everything about your personal situation and concerns.
So, after making sure you have an
Mm,
advanced healthcare directive, that is our first most important thing to do before you get sick. This is our second most important thing to do before you get sick.
mm.
Have a primary care physician you trust and visit them regularly.
So we've got 4 videos about what you should do before you get sick. Please watch them all. And remember, you're healthy until you're not.
For more on Celebrating Act Two, visit our webpage, follow us on Facebook, subscribe to us on YouTube, and tell your friends. Celebrating Act Two is the user manual for the second half of